Hello again. In this monologue, we are going back to the 80s.
Welcome to the Healthusiasm monologue by Christophe Joquet, a spoken column about making customers healthy and happy.
We are going through a crisis, and people talk about it. It's in the news. We are living times of fear, uncertainty, and doubt, the FUD times, as I'd like to call them. And we are curious, even perhaps anxious, to know how the world will look like tomorrow. How will this new normal be? I mean, we were living our lives, a crisis hits us, we are now in a period of chaos, which likely will take 18 to 36 months. And then after that, we slowly will move into a new normal, a new environment, a new world. And so people are really curious to know how this will look like. A lot of people think about it. A lot of people are shaping it or trying to shape it. And that's why they look for references. They go back in time and they look for situations which might be similar to this crisis, look for learnings and how they can apply it to today. But the thing is, people are looking to the 2008 crisis, but that was a financial crisis, of course. That was not a health scare or global pandemic. They are looking to 9/11, and that might be also global, but it was different. It was not driven by a health scare or a virus, which is a threat to all of us. The only health scare that we can think of, if you read magazines and newspapers and on the internet, is the 1930s, the Spanish flu. But that's so long ago. I mean, it's hard to actually take some learnings from there that you can still apply today because society has changed so much. But to me, there is one situation which is kind of similar to what we are going through now. It's not in such a way that people were closed in their house and that there's a global lockdown going on, but there was a global health scare. And that was in the 80s. In the 80s, 76% of people said that this one disease actually is a severe threat for society. 76%. And that disease was HIV or AIDS. And that was in the 80s when already people were confronted with large and broad media coverage about cardiovascular diseases and cancer, as well as Alzheimer. Those were not new diseases, but they were more widely spread and more covered in the newspapers. And suddenly people became aware of it. And that was kind of a change in society. So you have all these huge diseases that struck people, the population that was growing older. At the same time, you have this very specific contagious disease like HIV and AIDS. So people changed their behavior back then. I mean, it's not a coincidence that the 80s are called the fitness craze periods. Never before have people exercised that much as in the 80s. Fitness was hugely popular, even in the popular culture, in the music, and the way that people would dress up. But you can also see that in the number of smokers in society. About 40 to 45% of the population were smoking before the 80s. From the 80s onwards, you can see it drop down until the 16, 70% we are having today. People were more aware of their health and they really wanted to have an impact on it. So they stopped smoking, they drank less, and they changed their food habits and they started exercising more. That was the very obvious things that you can see. And I believe that at least a lot of the actions that people were taking then, people will be taking today as well. And I see them at 3 levels. One is safeness, second one is togetherness, and the third one is related to wellness. Safeness came about certainly with all this uncertainty and people didn't know what HIV was, how it could be spread, how you could get caught. And so there was a lot of information being put out, even by governments, but also by brands and companies who wanted to explain to people what it was really about. But there was also a lot of health information about the other diseases, cancer. How should you be living if you want to avoid cardiovascular diseases, etc. There was a lot of information that was spread out. The first preventative information was being put out in the 80s. Also, companies were focusing on their role in society, and they wanted to play a role related to the safeness. Corporate social responsibility programs actually were initiated in the 80s as well. So this safeness thing was already very present back then. A second thing is the togetherness. We were battling a disease which was unknown, and there were some very big diseases coming up, like the cardiovascular diseases and cancer. And so we stuck together, and we wanted to help others. That's in the 80s, charity events was one of the main things. You could say that it actually all became very popular in the 80s as well. There were walks done for cancer or one or the other disease. There were bicycle rides from one city to another to collect money for research. People came on the streets to actually put pressure on government to do research into HIV. Songs were brought out, and the actual profit from a song were invested in research, scientific research, or there were even entire concerts organized that would benefit society. People wanted to feel this togetherness, that they are actually fighting together against this health scare that people were going through. And then finally, wellness, of course. People wanted to feel as healthy as possible. And yes, we talked about the fitness craze. We talked about people smoking less. We talked about people drinking less even. But it was very present in other things as well. The 80s was also the period in which corporate well-being was being put forward. It was the first corporate well-being programs, which are now so popular, actually originated in the 80s. It was focused primarily on sitting correctly and stopped smoking and moving a bit more. But it existed already in the 80s, and the big companies actually initiated, like J&J, for example. At the same time, we saw people, because they wanted to have that much impact on their own health, we saw people, patients, being empowered. It was the first time that actually people wanted to come up against their physician. If they wouldn't agree with the way they were treated, they would change for this physician. Before the 80s, the physician was the god in town, and they would never contradict him. They would never doubt a physician. In the 80s, that all changed. People wanted to be more empowered to their health, and if they wouldn't feel well or at ease with a physician, or if they wouldn't trust them anymore, they would change it. So already in the 80s, we were dealing with a health scare which was related to one particular disease, but also with the fact that many other diseases became more widely spread. There was this health scare going on, and we see in the 80s the way that people behaved, and they went more into a need for safeness, a need for togetherness, and a need for wellness. And it is my conviction, my belief, that in today's reality, as we are dealing with a health scare, this small little virus that actually spreads very easily and that puts people into houses, and that also makes people say that this virus is actually a huge threat to society, this health scare will make people also focus on those same three things. It is safeness, it is togetherness, and it is wellness. So the question is, how can you as authorities, as a healthcare institution, as a brand or a company, how could you as maybe even a small company help your customers to help them in being safe and being together, or creating a sense of togetherness? And how can you help them in becoming as healthy and happy as possible? This is the question we need to ask us today, because it's unclear where we are heading, but we know what people want now, and they will be wanting it and they will be needing it for the next 18 to 36 months for sure. So let's try to make our customers healthy and happy. If you want to discuss this, I'm taking calls every Wednesday and Friday to briefly brainstorm with companies and brands, with people, with physicians, to discuss how you could, in your daily life, help your customers and being healthy and happy. Feel free to reach out through LinkedIn, my website, or email. I'll be happy to take your call. Take care, and let's talk soon. Bye-bye.